begin in a couple of minutes. Sure, absolutely. Perfect. So just see how there was a little bit of a lag time, but just a second or so, not even, but you can look here, and it'll be fine. Okay, now let me try this. Let's see if my phone can do this. So you'll actually, the sound will be over here. So you'll talk to, and here, it'll pick it up. It'll be just fine. Okay. I put my bag in front of there because the door like sometimes flies open, but it's all right. I'm not trying to keep you guys in here. Bags. Just shut off there. All right, we're going to begin today's webinar. So good afternoon and welcome to the Colorado Academy of Family Physicians' second lunchtime webinar. Today we have Carolyn Swenson and Tracy Foo, MD, MPH, presenting on effective conversations about marijuana in healthcare. Carolyn Swenson is the manager of training and consultation for the screening brief intervention referral to treatment known as SBIRT initiative at Peer Assistance Service, Inc. Carolyn has a background as a family nurse practitioner with additional training in public health. Tracy Foo is currently the marijuana clinical guidelines coordinator at the Colorado Department of Public Health and Environment. She is working to develop evidence-based clinical guidance for Colorado healthcare providers to talk with their patients about retail marijuana use or exposure. She completed her residency in general preventive medicine and public health at the University of Colorado, Denver, and earned her MPH degree from the Colorado School of Public Health. She received her medical degree from Drexel University College of Medicine. At the end of this presentation, you will learn how to reach Carolyn and Tracy, request training, technical assistance, and ask questions. So a couple of housekeeping items today. We ask you to please either view the webinar or call into the conference line, but do not do both. There is a 20-second delay, and it could be very confusing if you are logged onto both the webinar and the conference line. If you have any issues, please feel free to contact Erin Watwood at Erin, E-R-I-N, at coloradoafp.org. I'd be happy to help you with any issues you're having. We will be muting the conference line during this presentation, but you will have the opportunity to ask questions at the end of the hour. If you are viewing the webinar, you may ask questions in the Q&A box on the left side of your screen at any time. We will answer those questions at the end of the presentation. All of the documents for this presentation are available on our website at coloradoafp.org/webinars. And I'm going to hand it off to Carolyn and Tracy to start this presentation. Thanks so much.
Thank you everyone for joining this webinar today. I want to acknowledge the funder of the Screening, Brief Intervention, and Referral to Treatment initiative in Colorado. The funding comes from the federal government through the Substance Abuse and Mental Health Services Administration. Colorado is the recipient of 2 consecutive grants from SAMHSA to implement screening and brief intervention across our state, and we're in year 9 of 10. And I am going to go through the objectives for this presentation today and then turn it over to Dr. Tracy Foo. we plan to describe current efforts in Colorado to define the health effects of marijuana and to educate health professionals and the general public. We want to introduce supplemental guidance on marijuana that was developed by the SBIRT Colorado initiative to guide conversations and interventions by health professionals when working with patients to address marijuana and the health concerns around marijuana. And finally, we want to explore screening and brief counseling about marijuana in adolescents and adult patients and what the evidence says about effective ways to address marijuana as part of routine health care. So with that, I'm going to turn it over to Dr. Foo.
Hello, everyone. Thanks again for joining us. I just wanted to give a little bit of a background on methods of use that you might hear from your patients, and not everyone is familiar with all of these. Obviously, the first form that everyone thinks of is smoking. So people use joints of marijuana or cigarettes, marijuana cigarettes. Another form is edibles, which has become kind of a popular thing in this state. There are regulations from the Department of Revenue on edibles. Most recently, they did create a standardized serving of edibles as 10 milligrams of active THC with no products greater than 100 milligrams of THC. So there are regulations that are kind of constantly changing and constantly being adapted as need is seen. Some of these changes take time, but one of the more recent things, there is some changes going on with childproof packaging, and just so you know, all products do leave the dispensary in a child-resistant package that consumers can actually reuse. They pay a small amount for that, and they can bring it into their next visit and use that same package to bring their products home. Another form of use is vaping, which is similar to, a lot of times there's pens that are similar to an e-cigarette, which they use hash oil, which can have potentially a higher percentage of THC, and there's a battery-powered heating element that vaporizes the oil, which is then inhaled. Another method of use that's kind of been out in the public is something called dabbing. And what happens, or what they do is you can extract THC from cannabis either by a couple options. They use butane, which that's one of the ways that you hear if there's explosions and fires in people's houses. They use butane to actually extract the THC. There's also kind of more commercial-based ways of doing this with carbon dioxide. And the end product is a kind of a hard wax. A lot of times they call it earwax. And it can contain up to 70 to 90% THC. So it's a very high concentration. And what they do is you can smoke it via bong, and they use a blowtorch to heat the surface, and then they put a small amount of that wax on the surface, which is hot, and then you get a vapor that's then inhaled. So you're inhaling a very high concentration of THC. So just a quick background on some of the laws here in Colorado. As you may remember from Amendment 64, so adults 21 and older can possess as much as 1 ounce of marijuana and grow up to 6 plants for personal use. A couple of the other laws that came out of that was that it's illegal to give or sell retail marijuana to anyone under 21. It's illegal to retail marijuana on school properties or in outdoor or indoor public spaces. And it's important to know that some of the local governments have different laws, and there are certain counties that don't allow sale of marijuana. So be aware of any differences in your area. So some of the other important laws to point out. So the Department of Revenue does have regulations especially on advertising. So there's rules that packaging can't appeal to children or youth under the age of 21. It bans TV and radio ads, things like that. There are also restrictions on packaging, and there's currently a work group working to develop or see if there's some better way of doing that. But currently there are requirements for child-resistant packaging and also warnings on packaging. And in terms of the driving laws, marijuana does fall under the open container law. So similar to alcohol, it's illegal to have marijuana in the passenger area of a vehicle if it's in an open container or open package, or if there's any evidence that marijuana has been consumed. And the legal limit a lot of people don't know, but there's actually a limit of 5 nanograms of active THC in whole blood, and that's considered the level for impairment. So in terms of Colorado Department of Public Health, or CDPHE, we were tasked in the Senate Bill 13283 with a couple of things. First thing was to monitor changes in drug use patterns after the legalization of marijuana, and then also to look into what the health effects are associated with marijuana. The second was to create this panel of healthcare professionals to monitor this information. So one of the ways that we're doing surveillance is through kind of adding questions to some of the population-based surveys that we have here in Colorado. And so questions were added to things like the behavioral risk factor surveillance system, to our PRAMs to look at pregnancy information, the Healthy Kids Colorado survey, which there was data released for 2013, but they will be getting data for 2014 as well for next year. So these are some of the ways that we're looking into prevalence of use, and to get an idea of really what's going on in Colorado now that marijuana has been legalized. So the second part of that is to look at the health effects of marijuana. So through statute, the Retail Marijuana Public Health Advisory Committee was formed. And what they're doing is they're basically conducting literature reviews of the health effects of marijuana, to see what's out there and what we can say, and to make sure we have evidence-based information to give to patients. This panel is made up of a variety of healthcare professionals, some physicians, some public health, epidemiologists, toxicologists, representing different specialties. And basically what they've done is they've created a literature review process, which includes quality rating of each study, and they're going through, every month they go through a different topic, and see what the literature is, and whether, what kind of information is out there. And then they're creating public health statements and messaging that the committee approves, and also recommending further surveillance activities and research gaps. These are some of the topics, these are the topics that they are covering this year. So the first three with the kind of diamond shape bullet point are the ones that are actually available on the website that's listed below. Actually, if you just Google Retail Marijuana Public Health Advisory Committee, you can access the website, and there are finding summaries available for the first three topics. The dose and drug interactions topic was just approved this past week, so that should be up on the website within the next few weeks. But this is, if you're interested, you can go, the references are also available if you're interested in looking at some of the papers, but you can see all of the statements that the committee has approved. So this is just an example. These are the public health statements for the pregnancy and breastfeeding literature review. And it's just an example of what the committee has come up with. So you can read through these on your own. But they wanted to really find some statements that could potentially be used by other public health agencies or providers, to just some basic information to give to patients. Okay.
Sorry, if your phone is not muted, could you please mute your phone? Thank you.
So as part of the legislation around marijuana, CDPHE was also given funds to create a prevention campaign. So this initial media campaign is going to be to educate the public on safe, legal, responsible use of marijuana. And this will be coming out in early January 2015. It's an exciting thing. It's just going to be starting the conversation about what the laws are. Eventually we'll be talking about health effects and just getting the information out to the public. There will also be an ongoing campaign that will include targeted messaging for high-risk populations, so groups like youth, breastfeeding women. So what I'm working on is the clinical guidelines, and this was also outlined in the legislation to create these clinical guidelines. So these will be 2 to 3 page documents with evidence-based information about talking to patients about marijuana. So it'll include things like screening, some recommendations, talking points, and resources for both providers and patients. And the idea is to incorporate the messaging and the evidence that was approved and done by the Retail Marijuana Public Health Advisory Committee. So our initial topics are pregnancy and breastfeeding, and that's what we're working on right now. Our second topic will be pediatric exposure prevention, which includes things like safe storage, secondhand smoke exposure, and just basic kind of parenting information, and driving under the influence, things like that. So this is kind of a little bit of an outline for what we're working on right now with the pregnancy and breastfeeding guidelines. We're going to be including some screening recommendations, so including language to talk to patients, questions to ask, and also talking points. So what to say to your patient who's pregnant and using marijuana, or what to say if your patient isn't using marijuana but thinking about it. Also, including a statement on medical marijuana. I know a lot of patients feel that that's kind of a justified reason for using marijuana during pregnancy. And so just a statement that, it's important to consider the risks and benefits of medical marijuana during pregnancy, just like you would with any other medication. Just a little information on some current laws that are applicable to the pregnant and breastfeeding time period, such as that THC is actually still Schedule 1, both in Colorado and federally. So it is required for hospitals to report any newborn who test positive for THC to social services. So that information will be on there as well. We did a survey with healthcare providers looking to see what they wanted to see in these guidelines, or what questions they had, what was coming up. And one of the other topics that came up was just the issue around mandatory reporting, and when do you call social services about a patient? So initially for these guidelines, we'll just have some kind of some basic information. We are hoping to have some supplemental information as well, provided by the Colorado Drug Endangered Children Alliance, regarding when substance abuse is child abuse, and kind of just some guidance for providers to be able to figure out when they need to report. We will include just a little bit of information about secondhand smoke. There's not a lot of evidence around that, but we do know that the carcinogens in cigarettes are similar to, sorry about that, if you can hear that. The carcinogens in marijuana are similar to those in cigarette smoke. There will be a separate section on marijuana and breastfeeding, which is a kind of a contentious issue. But right now we're recommending, basically based on what the American Academy of Pediatrics and the American Academy of Breastfeeding Medicine recommend, that it's contraindicated during breastfeeding. But just some language to talk to patients about that issue. And we're also going to be including some information on parenting and safety, so things like safe storage, driving under the influence, safe caregiving, and then just some information on common myths or frequently asked questions. So there's certain things that come up that you always hear. So there's one study out of Jamaica that actually showed at 1 year that babies of mothers who use marijuana prenatally performed better on some testing. There's some issues with that study, but that's a study that's widely quoted by the marijuana using community, that, oh, it's actually better for my baby. So providing some information to providers so that, you have some responses to those kind of questions or things that might come up in discussions. And then also providing some resources for healthcare providers and patients. Some different, there's online web resources. The Colorado website is available as well, and with the new campaign coming out, there will be a website associated with that. So being able to provide some of those resources so that you can give that information to your patients. So our timeline for the guidelines, we hope to be pilot testing the pregnancy breastfeeding draft guidance in early 2015. And then we'll be working on developing the pediatric exposure prevention guidelines and also in early 2015. Just a little bit, things to think about when you're talking to your patients about marijuana, especially your patients that have young children or even older children. One of the important things is child-resistant packaging. You know, obviously that only works for the younger children, but reminding patients that, you know, the packaging that they get from the dispensaries is child-resistant and they can use that. And it's also important where they put their marijuana. So safe storage is important. So keeping it out of reach of children, potentially, you know, if it's possible to lock it up. It's actually required by law if they have if they're growing marijuana, that has to be locked. But potentially having a lockbox or something to keep their marijuana in so their kids can't get it. And that's not just young children, but also when you have parents of teenagers and stuff, is to think about that. We've all heard of the kind of unintentional marijuana exposures. There were a couple of papers that came out of Colorado, out of Children's Hospital, after the legalization of medical marijuana, showing that there were some increases seen in kids being seen at the ER and getting admitted. There was an article in the Denver Post where Children's released kind of some of their initial numbers for this year, and there was an increase seen. And I don't have any data after that. I don't think they've released that yet. But it's just something to think about, and you know, make sure that your patients are aware. And that's mostly with, obviously, with edible products. But making sure that, you know, if it's a brownie, kids think it's a brownie and they don't realize that it's not for them. So making sure that it's put away and not accessible to them. And the other thing that's important to point out is the importance of a smoke-free environment. So just because it's not tobacco doesn't mean that it can't affect kids. You know, we don't have all the evidence yet, but smoke-free is best. So making sure that parents are aware of that includes marijuana. I mentioned a little bit just about the mandatory reporters. This was some language that we had actually in some different guidelines that we're using for this. But basically something like, you know, adult use of marijuana is legal in Colorado, just like alcohol. However, it's important to make sure parents are aware of responsible use in legal substances. And basically it comes down to if you have a suspicion of abuse or neglect in a child, so if the health or welfare of a child is threatened, that it's your duty as a mandatory reporter to report child abuse or neglect. And just a little piece on adolescence. So there's an important role of the parent in prevention, and making sure to screen adolescents and talk to them about marijuana use is important. And to include marijuana in discussions about alcohol and tobacco. I mean, kids are getting these discussions anyway, but making sure to include marijuana. There's a great website. It's called speaknowcolorado.org, and it actually has age-appropriate information for adolescents and for parents. So, and it's a good resource for parents to talk to their kids about marijuana, alcohol, and other drugs. In terms of specific health risks, I won't get into all those. There is one of the literature reviews done by the Public Health Advisory Committee was the adolescent and youth adult one, and they have some statements regarding regular marijuana use by adolescents and young adults being strongly associated with impaired learning, memory, math, and reading achievement, even 28 days after last use. And there's some other statements around association with psychotic symptoms and things such as schizophrenia in adulthood. So it's something that you can take a look at if you're interested. Then just some other health considerations to think about. So there's been some kind of anecdotal reports that some older adults and elderly patients may be using marijuana or, you know, in perhaps edibles. And there's some anecdotal reports of use potentially leading to falls. So it's something to think about. I mean, you don't usually think about elderly patients using marijuana, but something to kind of keep in the back of your mind and for screening everyone, might be a good idea to include that population as well. In terms of mental health, there's actually a separate literature review on mental health in adults, and a couple of their public health statements are that heavy use of marijuana is associated with impaired memory persisting a week or more after quitting, and that regular use of marijuana is associated with depression. So that's something you can take a look at as well. The acute psychotic symptoms, so that's mostly associated with intoxication with THC. So if you've heard of, people might have heard of the Maureen Dowd, who was the reporter who came to Colorado and ate some edibles and had a bad reaction. But patients can what's called stack edibles, meaning that they can have multiple, kind of basically multiple servings of an edible because the effect takes longer to, a longer onset effect. So if they're kind of having one and then they wait a couple of minutes and then they have another one, that it can actually lead to some of these symptoms. Another thing that comes up is the cannabinoid hyperemesis syndrome. And this is usually seen in chronic cannabis users. It's fairly rare, but it's kind of been out there. So we wanted to just touch on it. One of the signs is that patients often take frequent hot showers or baths, and they have persistent vomiting. So it's kind of a diagnosis of exclusion, but something that's kind of been out there, especially since legalization. And then in terms of surgery, I think I was looking to see if there was any specific recommendations, and I couldn't find any. But I think, as with any substance, it's important to just ask patients about their use, especially before surgery. And if they're using, preoperatively, to encourage cessation before surgery. Again, like I said, I couldn't really find the evidence on that or any kind of recommendations from anesthesiologists. But I think that kind of follows in line with other substances that we ask about prior to surgery. So I'll get Carolyn back on the line here.
So hello again, this is Carolyn from the Screening Brief Intervention Referral to Treatment, or the SBIRT initiative in Colorado. And we've also been looking at how to address marijuana as part of our work to make substance use screening and brief intervention a routine part of healthcare, especially in primary care. And in January of 2014, we released a short summary guideline in the format that many of you may be familiar with, that Health TeamWorks used to develop multiple prevention and chronic disease management guidelines over the years. So this is a short summary of the evidence. The committee, the volunteer committee that developed this guideline, did not grade the evidence, but rather used existing publications as well as expert consensus decision making as part of the process of developing this one-page front-back guideline. So it provides some information that may be useful to the health professional in terms of understanding a little bit more about marijuana, also some general health effects to be aware of, and then some specific considerations for adolescent patients, pregnancy, postpartum, some safety concerns, including driving under the influence, a few key points on discussions with parents to encourage them to take a leading role in prevention with their teenage son or daughter. And then we go into some of the key points around what we know is most effective in terms of how to have short conversations about marijuana. And one area we devoted a fair bit of space to in this short guideline is some suggestions for how to address some of the common beliefs and myths that we are hearing in healthcare settings. And we also cover how to assess a patient who may have a cannabis use disorder and where to find appropriate treatment resources when that's indicated. So you can access this guideline through the SBIRT Colorado website, which will be available on the last slide of this presentation. And you can also call us. We're happy to send you copies of the guideline or help you access it if you would find it useful in your practice. So I'm going to go into a little bit more about the role of especially primary care health professionals and that setting as being a very important place for prevention of substance use disorders and early intervention, including around marijuana. So we know that substance use disorders are preventable, even though we sometimes see the devastating, long-lasting effects of a chronic substance use disorder. We also know that we can prevent these disorders, and one of the most important ways to prevent them is to begin screening all people, all patients, at least by early adolescence and maybe even earlier, and to make screening for alcohol and other drug use a routine part of care, because when we intervene earlier, patients are much more likely to have good outcomes. And we also know that screening in adolescence is especially important to begin that screening at that time of life, because the earlier that someone begins to use alcohol, marijuana, or any other drug, including tobacco, the greater the likelihood that they will develop a substance use problem in their life and have a more serious problem. So we know prevention begins early, that if we can prevent young people from ever starting to use alcohol, tobacco, or other drugs before age 21, that we're protecting them because of their as yet undeveloped brain. They're particularly vulnerable to the effects of substance use before they turn 21 or before even their mid-20s. So what is the evidence that screening and brief intervention, meaning a brief conversation about substance use, works? So the evidence is strong for alcohol, and we recorded a webinar recently on alcohol screening and brief intervention that you can access if you're interested. The evidence for drugs is not yet as robust as it is for alcohol. The United States Preventive Services Task Force issued an I statement, meaning insufficient evidence at this point for them to make a recommendation for or against screening for drugs as a routine part of primary care. And there was some recent research in JAMA, that a randomized controlled trial, actually 2 trials, that found that the brief intervention portion of the process of screening and brief intervention was not as effective for marijuana, illicit, or prescription drug misuse as it is for alcohol. And so the authors of those studies and the people who research this issue in our country have concluded that screening is still important. It's important for health professionals to identify use of marijuana and other drugs, but patients who do use these substances may need multiple or more intensive interventions, especially those people who've been using substances for a long time or have more problems associated with the substance use, such as health, legal, or social problems. And so as far as the evidence for screening and brief intervention in adolescents, the U.S. Preventive Services also issued an I statement concluding that there's insufficient evidence to make a recommendation on routine screening in primary care. However, the American Academy of Pediatrics does recommend that adolescents starting at least by about age 12 and perhaps younger should be routinely screened for alcohol, drug use, and tobacco. And that, again, adolescents may require a more intensive intervention, more than just one brief conversation, to help motivate them to change a pattern of use. And I'd also like to mention that that positive reinforcement given by a trusted family physician or pediatrician is really effective at helping to discourage adolescents who have not yet begun to use alcohol, marijuana, or other drugs from ever initiating use of those substances. When we say screening, what we mean by screening is to use a validated question. Now, the questions that are typically used to screen adults for drugs usually group marijuana with illicit or illegal drugs. And of course, in Colorado, technically, marijuana is not an illegal drug. So in our work around Colorado to implement routine screening for marijuana as well as other substance use in primary care, we have developed the question that you see on this screen. How many times in the past year have you used marijuana? We chose the word used rather than smoked to make sure that we're capturing all forms of marijuana use. And we consider, in our SBIRT work at least, a positive score to be 1 or more times of reported use, so that it allows the health professional to explore the pattern of use and offer a brief intervention for harm reduction, even if an adult is using marijuana in a way that's legal in Colorado. As part of our SBIRT work, we hope to have the opportunity to actually validate this question in a primary care setting as well. For screening adolescents, I already mentioned who and when to screen, and the tool that's most recommended and most often used at this time in primary care is called the CRAFT. It's a 6-item screening tool that screens adolescents for alcohol and drugs. It was validated in a primary care pediatric population under age 21. And if you're interested in more information or even training on using the CRAFT in your practice, that is something we offer through the SBIRT initiative in Colorado. So then, once you've screened a patient and identified use of marijuana, it's what do you do next? And the brief intervention step of the screening and brief intervention model recommends 1 or more conversation to engage the patient about their use of the substance and to encourage harm reduction when appropriate or abstinence when appropriate, and to help motivate the person to cut back or change their pattern of use in some way. In our work around Colorado, we've gathered feedback from practicing health professionals and health educators who routinely screen patients. And we've identified some common issues that come up in these conversations with patients about marijuana. I've listed just a few of the most common things that tend to come up on this slide. Adolescents, for example, may be thinking, well, since the adults in Colorado voted to legalize marijuana, it must indicate that it's a relatively benign substance. People often tell us that it's all natural, so how could it be harmful? And they often compare it to alcohol and conclude that it's better than using alcohol or tobacco. We've gotten the message out. We've made good progress from a public health perspective on alcohol or tobacco. So now people are sometimes perhaps replacing marijuana with other substances. And there's a very strongly held belief that marijuana is not addictive. And in reality, we know that the earlier that someone starts using marijuana in their life, the more likely it is that they can develop a cannabis use disorder. And then, of course, there's many reasons that people will state that they're using marijuana commonly to address things like stress and anxiety and pain, of course. And then, as I already mentioned, often people compare it to the risks of drinking and driving and conclude that that they're not in very much danger at all or likely to harm others by driving after using marijuana. So in our work and training, we do encourage that health professionals strongly make a statement or advise abstinence, especially with adolescents, pregnant women, people with certain chronic health problems where marijuana could exacerbate a health problem, but that we also encourage health professionals to keep the door open to ongoing communication and address harm reduction when a patient is unwilling to completely abstain from marijuana use. So the way we train about this is to make sure that you start off your conversation with a strong personalized message to abstain, but then ask the patient, what do you think about this? To give them the opportunity, and we're finding they often do reveal that they don't think they can abstain, that that's not going to work for them. So that opens the door to a conversation about how can they reduce the risk of harm to themselves or to others if they continue to use marijuana. The model for having a brief conversation that we usually introduce in our training is called a brief negotiated interview. The brief negotiated interview was developed for emergency department settings as a way to offer a structured, short conversation to a patient and cover a fair bit in even 5 minutes of conversation with a patient. So these are the 4 steps that we introduce in our training: to raise the subject, provide feedback to a patient, enhance their motivation in the direction of change, and to negotiate a plan and next steps to come to an agreement. And it may sound somewhat similar to the tobacco 5 A's, and it is. It's similar to that approach to having an interactive conversation with a patient. I went through this 4-step process in more detail in the alcohol webinar, and I'm only going to briefly touch on the 4 steps right now, and then Tracy and I are going to demonstrate a brief negotiated interview about marijuana for you. So you start by raising the subject, ask permission to even have the conversation with the patient. Provide some feedback, ideally personalized, about why you're concerned about the use of marijuana. In this slide says alcohol, but it could be any substance you're discussing with a patient. But don't give too much information, and always ask the person to respond to that feedback. Ask them, what do you think about this? How does this apply to you? Step 3 is where you spend the most time. The idea here is to enhance someone's motivation in the direction of change, to identify how ready or how important is it at this point to them to make a change, and then explore their ambivalence about readiness to change, and keep the door open in all cases to future conversation, especially since around marijuana and other drug use, it's often particularly important to have an ongoing conversation with a patient, and the primary health care physician or other health professional is ideally suited to that ongoing conversation. So there's a few slides that give some examples of how to motivate a patient, how to enhance that motivation. And then step 4 is to simply negotiate and advise next steps, wherever you have arrived at in the conversation with the patient. What are some steps that the patient might want to take to cut back, to change their pattern of use of marijuana, and to keep that door open to check in with them in the future about how it's going and how you can express your concern about how marijuana could be affecting their health in the future. So let's show you what we mean by having a short conversation about marijuana in a primary care health setting. So I'm going to introduce a patient to you and then have a conversation with this patient. So Jenny is 21 years old. She came to the clinic today because of a cough that she's had for about a month now. She has no major health problems, and her exam today did not reveal a serious illness. All patients at this clinic are administered brief screening questions to assess their use of tobacco, alcohol, marijuana, and other drugs. And this is the follow-up conversation between the health professional and Jenny. So Jenny, I didn't detect any signs of a serious illness like pneumonia today. I think the cough medicine is going to help. Plus, I want to make sure you drink plenty of fluids.
Okay, I can do those things. I seem to be just getting a cold every time that it goes around, and I really can't afford to miss any work now.
Okay. Well, there's one other thing I'd like to discuss with you before the end of our visit today. We ask all patients about tobacco, alcohol, marijuana, and other drugs, and you said you don't smoke or use any form of tobacco. That you have about 2 servings of alcohol a week on average. Is that right?
That's right. Yeah, no smoking, and I only drink a little now and then.
Okay, so those are both very good choices for your health. You also mentioned that you used marijuana several times in the past year. Is that right?
Yeah, you know, we live in Colorado.
Yeah, it's pretty common here. I know it is. Would it be all right if we talk for a few minutes about marijuana and your health?
Sure, I suppose so.
So I'm curious, what are your reasons for using marijuana?
Well, you know, lots of my friends smoke pot. It's just something we do sometimes when we're together. It's kind of a way to read. Plus, things are really stressful right now, and I've had some trouble sleeping.
So you're experiencing quite a bit of stress that's affecting your sleep? Is that what I'm hearing?
Yeah, I mean, the past few months have been really hard. They've laid off some people at work, and I've taken on a lot of extra work. Some nights all I can do is think about things I don't finish at work.
And smoking marijuana seems to help?
I think maybe it does, at least sometimes.
So marijuana maybe seems to help sometimes, but you're still experiencing a lot of stress and having some trouble sleeping. Did I get that right?
Yeah, that's right. Plus, this cough just makes it even harder to sleep, so it's hard to say what's really going on.
So about how often are you smoking marijuana?
Oh, I'd say probably 5 times a week.
So almost every day.
Yeah.
What do you know about how marijuana can affect a person's health?
Well, it's safer than smoking cigarettes, isn't it?
Well, it is true that smoking cigarettes is very harmful to a person's health, but there are also some health risks associated with marijuana. In fact, people who smoke marijuana regularly may be more susceptible to getting colds and to develop a chronic cough. What do you think about that?
I don't know. I thought I was probably just getting all those colds because of the stress at work.
Well, you're right that stress is also harmful to your health. So you smoke marijuana to relax, to help you manage stress. I'm curious, what are some of the not so good things about smoking marijuana for you?
I don't know. I suppose I spend a fair bit of money on it. It does add up.
Anything else?
No, nothing that I can really think of, unless maybe it is making my cough worse.
So on the one hand, smoking marijuana is a way to relax. On the other hand, it's expensive and it could be making your cough worse. Is that what I heard?
Yeah, that's right. But at least really it's not addictive.
Well, actually, I want you to know that people can become addicted to marijuana.
Really? That's not what my friends say.
We know that marijuana can be especially harmful for teenagers and young adults because their brains aren't fully developed yet. And it has been linked to depression, problems with learning and memory, even longer term. And like I said, some people do become addicted.
That doesn't really sound that good.
So what do you think? Where does that leave you now in terms of your marijuana use?
I don't know. What do you mean?
Well, we've talked about your reasons for using it, some of the health risks, and the cost. Considering those things on a scale from 0 to 10, where 0 is not at all important and 10 is very important, how important is it to you to quit marijuana altogether or even cut back right now?
That's an interesting question. I guess maybe a 6 or a 7.
So it's somewhat important to you.
Yeah, I suppose so.
So what makes you give it a 6 or a 7 and not a lower number?
Well, this cough is really interfering with my life and making it even harder to keep up at work. I didn't really think smoking pot could have anything to do with it, but if it does, then that's maybe a reason to quit for a little while.
So to help with the cough is one reason. Anything else?
Well, I guess I'm gonna have to think about some of those other things you mentioned.
Like,
Well, like you said, it could affect a person's memory.
yeah, I did. So the way marijuana can harm a person's brain may be another reason for you to consider a change.
Yeah, I guess so.
So what's the next step you think you'll take?
Well, maybe I'll try laying off the pot for a little while and see if it helps with my cough. Then I guess go from there.
Well, that sounds like a really good idea. So you plan to quit smoking marijuana in the short term, at least, and consider some of the other reasons to quit or cut back long term. Did I get that right?
Yeah, that sounds about right.
And how confident do you feel that you'll be able to do this?
Oh, probably about an 8.
So you feel pretty confident that you can take this step.
Yeah, I think so.
Well, these sound like really good steps you're taking for your health, and I'd like to check in with you about this in the future. And of course, I want to hear from you if your cough doesn't get better.
Okay, that sounds good.
Well, thank you very much for having this conversation with me today.
Thank you.
Okay. So just a couple more slides before we close this webinar. If you have any questions, by the way, on that brief conversation, any feedback for us, please feel free to pass that on to us. So occasionally you may encounter a patient where you're concerned that actually their pattern and level of marijuana use indicates that they are beginning to develop or have developed a cannabis use disorder. There is a screening tool that you can find easily online. It's in the public domain, called the QDIT, the Cannabis Use Disorders Identification Test. It's a short tool that could be self-administered and may be helpful in a primary care setting to identify patterns of use as well as consequences or problems associated with use of marijuana, and help you make a clinical judgment about what types of next steps and interventions may be warranted for a patient. And when you do identify someone for whom you're concerned that there's a more risky or serious pattern of use already underway, some of these questions can be helpful as a way to start a conversation and keep the patient engaged. Just open-ended questions such as, how does your current pattern of use fit with what matters most to you in your life? Or for a person who's really not convinced that this is a problem for them, you could ask them, how would you know if it were becoming a problem for you? What would have to happen for it to seem like a problem to you? And then even when someone's not ready to quit or cut back, you can ask them, what would they do? What steps would they take if they did decide it was important to quit or cut back on their marijuana use? Just to get them thinking about, in the event that they're ready to make a change, how are they going to do it? And for you, the health professional, it can help you understand what types of help or assistance they may need when they are ready to make a change. There may be times when you will need to identify substance use treatment services, recovery support services, and prevention services such as for adolescents. And I want to introduce you to a website that is a Colorado-specific database of substance use treatment providers and mental health providers, as well as recovery support and prevention services in our state. This website was just recently redesigned so that it's now mobile phone friendly, and you can search this website geographically, such as using a zip code, to identify services in your region. And if you would like more information or even a tutorial on how to use Linking Care, how to train the staff in your practice to use Linking Care, we'd be happy to provide that service to you through our SBIRT work in Colorado. So if you have questions, would like materials or resources, anything you've heard about in this webinar, or training services to help you address marijuana and other substances in your practice, please feel free to contact us. My contact information is on this slide, and I can also pass along questions or requests for information to Dr. Foo if you want to contact me. So we thank you very much for participating in this webinar today. We appreciate your time.
Thank you, ladies. We'll open this up for any questions here. If you do have any questions on the webinar side, you are welcome to ask them on that little Q&A screen. And then if you have any questions via the conference call line, I will unmute the line now. So the line is now open if you would like to ask any questions. Are there any questions? We'll wait a couple more seconds and see if there's any questions here. Okay, thank you so much and have a great day. This will be on our YouTube channel, and it will be at, if you'd like to look at any of the attachments, you can go to www.coloradoafp.org/webinars. Thank you so much and have a great day.